Hey everyone, and welcome back to the channel. Today, we're diving into a topic that continues to shape our world, the ever-evolving coronavirus. It feels like just when we get a handle on things, a new subvariant pops up on our news feeds. So what's really going on? Let's break down the science, the risks, and what it all means for us today. From the very beginning of the pandemic, the SARS-CoV-2 virus has been doing what all RNA viruses do best. It mutates. As it spreads from person to person, tiny changes occur in its genetic code. Think of it like a game of telephone where the message gets slightly altered with each telling. Most of these changes are harmless, but occasionally, a new version or variant emerges that's different enough to catch our attention. Scientists and public health organizations like the World Health Organization, or WHO, keep a close eye on these changes. Why? Because these genetic shifts can affect how easily the virus spreads, how sick it makes people, and how well our vaccines and treatments work. The WHO has a classification system to keep track of all this. They categorize variants as variants under monitoring, variants of interest, and variants of concern. This system helps prioritize which versions need the most urgent study and attention. You probably remember the name Omicron. It first appeared in late 2021 and was quickly labeled a variant of concern. Omicron had a huge number of mutations, especially on its spike protein, that's the part of the virus that latches onto our cells. These changes made it incredibly contagious and better at sneaking past the immunity we had from vaccines or previous infections. Since then, Omicron hasn't just disappeared. It has become the ancestor of thousands of different sublineages that have caused waves of infection all over the globe at different times. Fast forward to more recent times, and we've seen new descendants of Omicron continue to emerge. One that got a lot of buzz was BA.2.86. It first popped up in 2023 and immediately raised eyebrows because it had a massive number of mutations on its spike protein. The jump was so significant that some experts compared it to the leap from the original Wuhan strain to the first Omicron variant. It was first found in Israel, then quickly spotted in Denmark, the US, and the UK. This rapid spread prompted intense investigation. Was this the next big one? Initially, there was a lot of concern. But as the data came in, it seemed that BA.2.86, while different, wasn't causing more severe illness than other circulating strains. The WHO classified it as a variant of interest, meaning it was one to watch, but not yet a full-blown crisis. The global immunity wall we've built up over the years played a huge role here, but we'll get more into that in a bit. More recently, another player entered the scene, a subvariant known as NB.1.81. This one has been linked to an uptick in cases in parts of Asia and the Western Pacific. It's been detected in over 20 countries, including the US, the UK, China, and India. Genetic analysis suggests it has a bit of a growth advantage over other subvariants, meaning it might be better at spreading. So should we be worried about NB.1.81? Well, public health agencies like the European Centre for Disease Prevention and Control have it listed as a variant under monitoring. This means they've noticed it and are tracking it, but so far, the overall risk to public health is considered low. While some countries saw infection rates rise as it circulated, there wasn't a corresponding spike in hospitalizations or deaths directly linked to it. The situation is still being monitored closely because even small changes in a virus can have big consequences, especially for vulnerable populations and our healthcare systems. Now, let's talk about symptoms. What does it feel like to get sick with these newer subvariants? For the most part, the symptoms are pretty familiar: fever, cough, fatigue, a sore throat, stuffy nose, body aches, and headaches. You might have heard some anecdotal reports about specific symptoms, like a particularly nasty sore throat described as feeling like razor blades. Well, some people have certainly had that experience. It's not a universal symptom, and individual experiences can vary a lot. Health experts stress that the symptoms of COVID-19 still overlap quite a bit with other common respiratory illnesses like the flu or the common cold. So if these new variants are still emerging, why aren't we seeing the same level of severe disease and chaos we saw in the earlier years of the pandemic? A huge part of the answer is immunity. After years of vaccinations and infections, the global population has built up a strong defense. Our immune systems are now much better at recognizing and fighting off the virus, even if it's a slightly new version. This is why vaccines, especially the updated formulations designed to target more recent strains, are still so important. They are our best tool for preventing the worst outcomes, like hospitalization and death. Even if you get a breakthrough infection, being vaccinated significantly reduces your risk of getting seriously ill. Recommendations might change from country to country based on local immunity levels and disease patterns, but for those at higher risk like older adults or people with underlying health conditions, vaccination remains a key recommendation. Beyond vaccines, the other strategies we've learned are still just as relevant. One of the most powerful tools we have is genomic surveillance. This is where scientists rapidly sequence the genetic code of virus samples from patients. This allows them to spot new mutations as soon as they appear and assess their potential impact. It's a massive, global collaborative effort that helps public health officials update their advice on vaccines, testing, and treatments. Of course, all this surveillance relies on people getting tested. One challenge we face now is something called pandemic fatigue. We're all tired of this, and many people with mild symptoms might not bother to get a test anymore. This can create blind spots in our data, making it harder to know just how widely a new variant is spreading. It highlights why maintaining our health monitoring systems is crucial, even when things seem quiet. Finally, we also have effective antiviral treatments that can be used for people who do get infected and are at risk of severe disease. These treatments can help reduce the severity of the illness and improve clinical outcomes, adding another important layer to our defense. So to wrap things up, yes, the virus is still evolving. Subvariants like BA.2.86 and NB.1.8 show us that this process is ongoing and requires our continued attention. But the good news is that the world is in a much better place to handle it. Thanks to widespread immunity, effective vaccines, and advanced surveillance, these newer variants are not posing the same level of threat as earlier versions like Delta. The global effort of scientists, doctors, and public health agencies is what keeps us ahead of the curve. And as individuals, we can do our part too. Stay informed through reliable health sources, get vaccinated according to your local guidelines, practice good hygiene, and seek testing and care if you feel sick. Understanding that the virus will keep changing helps us respond in a calm, smart way that protects our communities and minimizes the impact of COVID-19 on our lives. Thanks so much for watching. If you found this video helpful, please give it a thumbs up and consider subscribing for more deep dives into the science shaping our world. Stay safe, and I'll see you in the next one.